Hello, I'm Dr. Hanume Gowda, consultant orthopedic surgeon practicing at AHA Orthocare, Nagarvavi, Bengaluru, specialized in joint replacements and spine surgeries. Shoulder is the most mobile joint in the body. Maximum movements are possible in shoulder compared to any other joint. It can move in all directions and in all possible ways you can move your shoulder. So when it is so loose a joint, when the movements are too much, injuries are also equally more in the shoulder joint. Pain of the shoulder joint is very common. It can be simple strain to a major complex joint ligament injuries also can happen. Generally, the causes for shoulder pain are injuries that can happen which are more than the actually limit that can be done. Example, you can lift up your shoulder and take it only to this level. If you try to push it a little bit more, then it can lead to an injury. So these are the common things. More so it happens in sports person when they do extreme movements to get to the best of their abilities. It can happen that they injure some sort of ligament or a tendon inside the joint. There are multiple parts in the shoulder. They are divided like bones, then the cartilages, then there are ligaments, there's a capsule, then there are tendons and the surrounding fascia. So any of these can get injured or inflamed when you're playing sports, and that can lead to a long-standing shoulder pain. Common problems are rotator cuff injury. Rotator cuff are a group of 4 muscles which start from the back of the shoulder and come and get attached to the humerus bone, that is the major bone of the shoulder joint. Those muscles help in lifting your shoulder up like that, and this muscle gets injured in most of the sporting activities, or even small little accidents or small little household work can lead to injury of this rotator cuff muscles. The other causes of shoulder pain is inflammatory disorders, then age-related problems, then problems related to diabetes like frozen shoulder. All these things can lead to shoulder pain on and off. The common things are rotator cuff, then the biceps tendinitis, then the capsulitis, then tear of the ligaments inside the joint. Then there is something called a glenoid labrum which can get torn while you do excessive movements like cricketers going for bowling, cricketers going for deep diving catches. These things can lead to damage into the deeper of the shoulder joint. Age-related arthritis can happen without any injury in the shoulder, and also there is something called a frozen shoulder, commonly called frozen shoulder, but it's called periarthritis in orthopedic terms. That can also happen without any injury or small minor injuries which are negligible. Then there are other situations like inflammatory arthritis which can affect the other joints of the body, can also affect the shoulder joint, like gout, uric acid situations, and also rheumatoid arthritis and other inflammatory arthritis or autoimmune disorders can also lead to the shoulder joint pains. Usually these pains will be both sides, or at least there will be some other joint in the body that will be involved. Shoulder pain, if it has gone beyond 48 to 72 hours, that is 2 or 3 days, is probably going into a little bit of a serious problem or a long-term problem. You'll have to seek a doctor's intervention, get necessary tests or necessary examination done and take treatment. Whether it is because of injury or without injury, if the shoulder pain is going on for more than 72 hours, that is 3 days, there has to be some sort of treatment taken. The basic things that can be done is to get an X-ray done and get a proper shoulder examination done by an orthopedic surgeon who will be able to tell you exactly what the problem is. Earlier you take the treatment, the better. The treatment will be a little bit of a shorter term and you can get your pain relieved completely. If you wait for long, then the treatment also can become longer. You will need more investigation other than X-rays. You may need a CT scan or an MRI scan, and further treatment can lead to injections into the joint, physiotherapies, and also sometimes surgery. So the faster you give attention to the shoulder pain, the better for you. Gymming, workout, particularly lifting of weights and doing those huge machineries where you just pull and push this thing called multi-gym or whatever, these things can lead to a lot of shoulder injuries. Initially it will all be muscular, the muscles are getting tired or muscles are getting a little bit heavier, they can go into spasm, they can be relieved with rest and some sort of cold compressions and taking medications, it can be relieved. But if the activity is too high, heavy weight lifting, over the head, lifting a weight, lifting it above the shoulder and above this thing, can lead to rotator cuff injuries or swelling in the rotator cuff tears, and also bicipital tendinitis. Biceps is another muscle which is very key in the shoulder and the arm. It stays in the front of this place. That can also get inflamed in the shoulder. If it starts from the shoulder, then that also can lead to severe pain. When you see such situation, that is tendinitis or little bit of inflammation inside the joint or injuries into the joint, we'll have to give proper rest and take a course of treatment which will be recommended by your orthopedic surgeons. At times rest, at times physical therapy, at times injection into the joints, and or just medications will give you good relief from the pain. When you get these shoulder pains after a heavy workout, it will be usually muscular. Give it enough rest or small little activities in the initial phases and slowly start scaling it up, like workout for only about 5-10 minutes initially, and then if you want to do heavier activities or long-term activities, you can increase it to 30 minutes, 40 minutes, but go gradually. Initially, first 3-4 days, do it for only about 5-10 minutes so that the body and the muscles get used to the situation, and then you can scale it up. You can put more loads on the muscles when they get primed or when they get toned into activities. If you start doing heavy activities right from the beginning, your shoulder will give way, your muscles will give way, and probably you will not be able to do such activities in future. So go slow is the best thing, but you have to be a little bit concerned about all these things. Have a proper trainer when you do heavy weights, when you do all those high intensity activities. You will have to have a trainer who knows exactly what to be done, what not to be done, and what time the scaling up happens has to be generally put into a proper chart, and accordingly you should follow it. Physical therapy in shoulder pain is very, very important because the shoulder recovery is a bit slow. As I said, shoulder is the most mobile joint, so recovery is also a little bit difficult in shoulder because of so much of movement happening. You will have to control some movements and you will have to increase some movements. All these things can be helped by a physiotherapist. There are multiple physiotherapy modalities that are available: exercises, heat therapy, then manipulations. All these things are graded according to your situation. Not one particular physiotherapy fits all problems. Each problem has got a different type of physical therapy that is to be done. So stretching of muscles or stretching of the joint when you have pain can lead to problems, then help it. Because shoulder pains are usually because of overstretching rather than under. So if it's already a stretched muscle, if you stretch it a little bit more, it can lead to problems. So stretching is not the way to do in shoulder unless you are consulting a qualified person who knows exactly which muscles to be stretched and which not to be stretched. So home remedy for shoulder pain in terms of stretching should be avoided. What home remedy you can do is taking painkillers or small little tablets or little bit of heat therapy, sprays and massages on the surface is something that you can do in the initial phases. If it's not helping you, then you will have to meet a doctor because it will need a proper structured program to get the shoulder back to normal. Treatment plan for shoulder pains is very linear. Initially, we give it rest, a little bit of rest, painkillers and medications available which can heal the joint if at all there are small little minor damages. If it's not going to help, then we'll have to go for higher investigations. Initially X-ray, then probably an ultrasound of the shoulder to see if at all there are any tendon injuries, or a CT scan to see if at all there are any bony injuries or bony damages, an MRI scan which will give all the details of the shoulder. So based on that, your treatment will vary. It can be again medications, or it can be a physical therapy where you need a little bit of manipulations and a little bit of mobilization of the joint, heat therapy, then conditioning of the muscles around the shoulder joint. The last, which is not actually recommended all the time, but if at all there is no other thing that can be done, then we'll have to operate upon to repair the damaged structures. It can be a rotator cuff tear, it can be a ligament tear, it can be a rupture of the ligament, it can be rupture of a tendon. Anything of this can be fixed with good results, with completely good results. You can get back to normal activities even after surgery. There's nothing to get scared of shoulder surgery, but the thing is, it has to be properly managed and it has to be properly planned, and there is never a problem with all these things. Results are uniformly good in shoulder surgeries.